All right. Good evening, everyone. I want to welcome you all to today's live class session. Class is in session, and I want to create your indulgence to feel free to participate, as this 1 hour facilitation is for us to interact together. It's for me to facilitate you and not to lecture. And a very quick, important announcement before we continue in the facilitation is that it is very important for learners to download and listen to the instructional videos that is earlier provided on the university page. And listen to them, also attend the Zoom class session, attend to assignment, participate in the quiz that will be given in the course of the facilitation session. All these would be used to add up to your final assessment. So for this reason, I want to encourage every student to please participate, attend, and listen to the instructional videos. And so today, last week, I was online. It was unfortunate that I think only one student also joined the class, and she joined, I think, about 30 minutes to closing time. So we couldn't hold, but the instructional video on module 1, which has 2 units under it, has been uploaded since last week. So you feel free to download it and listen to it. And today we are moving on to module 2. And module 2 has 6 units under it, and I've subdivided module 2 into 3 sessions. Today in our class, we'll be covering part A. Next week, we'll cover part 2, and the week after it, we'll cover part 3 of module 2. So today, module 2, part 1. What are we going to look at? We're going to be looking at occupational health problems, the overview, as well as occupational diseases. And I want to create your indulgence to discuss and interact what you understand by occupational health problems. So let me share from what you know about occupational health problems. Send your feedback on the chat as we interact together for the next 45 minutes of this facilitation. What do you understand by occupational health problems? You are a nurse. You have been employed in an industry. Take, for instance, maybe Nestle or any industry or company. So tell us what you understand by occupational health problems. Remember, this is not a lecturing period. This is a facilitation period. Students are supposed to come back with feedback because it's the same topic that has been covered in the instructional video is what we are now I'm going to facilitate you upon. And so for that reason, I'm not to repeat what I've said in the instructional video. And for me not to do that, it means that you have to interact with me. You need to ask questions. You need to ask for area of clarification, and we can interact from there. So what do you understand by occupational health problems? Of course, you know, occupation, health, and problems. This simply means that problems or health challenges or health problems or hazard or accident or trauma that an employee sustain in workplaces. So okay, Salau, I'm waiting. Feel free to send your response. Use the chat, and let's get your understanding from what you have learned so far. The course material has been uploaded with other material. I've also uploaded short videos on occupational health and the role of nurses in the industry. So from that, what can you tell us? What do you understand by occupational health problems? Give us an overview. An overview of your understanding about occupational health problems. Then we move to occupational health diseases. Okay, while I'm waiting for your response, I'm going to share my slide on what I prepared for this session. As I've introduced that we are on module 2, part 1. And in this module, at the end of today's facilitation, learners are expected as well to be able to understand the meaning of occupational health problems and diseases. In addition to that, learners are also expected to be able to differentiate the different types of occupational health problems and describe the types of occupational diseases. In addition, the causes or the predisposing factors to occupational health diseases, the conditions that contribute to employees' increased risk for health problems. What are the preventive measures? At the end, learners should be able to mention or explain the preventive measures to occupational health problems to employees and the ways by which it can be managed. That is, management of common health problems in the work environment and the way to control it. So we have seen those are the learning goals. The learning goals for module 1, module 2, part 1. And so when we say occupational health problems, what areas of the body that is affected? We will see that an individual is a whole. From your head to your toe, you are a complete person. And so when you are working in an industry, any of the part of your body or organs of the body can also be affected, beginning from your lungs, your eyes, your nose. For instance, if you are working in an industry that produces a lot of noise and you did not use your protective gadgets, at the end, you start having hearing impairments. You start having problem with hearing. You can hardly hear when people talk. And this is an occupational health problem. And so an individual also can be affected. The individual lungs, the respiratory system of a worker can also be affected when an individual is working in an industry that is producing, let's say for instance, asbestos, cement. This, if an individual is not provided with protective equipment, the person can begin to develop problems in the respiratory problem, in the respiratory system. And so the person will begin to have respiratory related challenges, diseases. And so it is your role as a nurse that is employed in an industry to be able to identify this hazard and to be able to recommend preventive measures to them. And so when a person is employed in this industry and you are asked, okay, Mary, welcome to the class. Thank you for joining the online class session. I welcome you again. So as I was discussing with you, that it is important to take preventive measures to avoid employees having health problems, occupational health diseases. And I mentioned that the respiratory system, not only the respiratory system can be affected. An individual, an employee, or a worker can also have a cardiovascular problem related disease, such as hypertension, which is a common heart problems or a common cardiovascular problems that a lot of people have these days. What are also other areas, other systems in the body that a worker can also have? We also have the musculoskeletal system. In an industry where employees have to lift objects, not using machine or other devices, such an employee can also develop a musculoskeletal problem. What do we mean by a musculoskeletal problem? A musculoskeletal problem is a problem that affects, or when an individual sustains an injury to the back, to the neck, to any bony parts of the body. It's called musculoskeletal problems. And so there are various traumas or problems that employees can have during occupational period, during the working period. But it is advisable that proper preventive measures is taken so that although the okay, and so although all these challenges are there, but how do you as a nurse help the organization as well as the employer and the employee not to, at the end of their working years, not to become useless? What do I mean by useless? When you ended up having disease problems as a result of your work, then when you stop the work, it becomes a challenge to you. And so that takes us to factors that we need to look at which contribute to these problems. And when we know these factors, then we can be able to eliminate. In a situation where we can eliminate it, we reduce it. So, and these factors are the biophysical factor, the psychological factor, as well as the social factor and behavioral factor. In fact, this behavioral factor is very, very essential because many times the workers themselves do not take their health very serious. How do I mean? It is your role as a nurse to emphasize to employees the importance of their health, that their behavior, their attitude towards their health, it's as both positive and negative. And so a continuous health education creates an awareness to the employees, which helps in preventive measures to occupational health problems. And so before we continue, I want to pause here and get your feedback, your comments. What are your comments on what you have understood so far from what we have discussed? A lot of you have experience already. Some of you are already working. So, and you have listened. I assume that you have listened to the instructional video. And so let me share from your experience. Like I do say, it is not enough that you join the class session. Your participation is very important. As a matter of fact, I crave for your contribution because this session, this 1 hour session, it should be an interaction. It should be an interaction and not a lecture. And so when you don't contribute and give feedback, it becomes a lecture and it defeats its purpose. And so allow me not to do the talking alone because we are not in the lecture room. And so I'm waiting for your feedback. What other preventive measures would you take as a nurse working in an industry to prevent occupational health problems and diseases? I'm waiting for your comments in the chats as I share a few things that I've put on slide. On the slide here, I have pre-employment medical examination of all employees to rule out the presence of any health problems and potential for hazard in the job. Periodic medical examination monitoring of all employees. Provision of safety equipment such as eye goggle, safety boots, helmet, apron, and face masks. Regular inspection of food preparation, serving and storage facility, as well as the environment. And so we've just covered Unit 1 of Module 2. And we've looked at the meaning of occupational health problems, as well as the preventive measures. We also look at the factors, the predisposing factors, and the preventive measures for occupational health. And so the next we're going to look at is Unit 2 of Module 2, which is basic occupational diseases. What are common diseases that are prevalent to employees? The common diseases that are prevalent to employees. So, of course, we know that diseases or a disease is any condition that arises from a workplace. When an individual is exposed to hazard in the job place, the person has a health problem. And so, and mind you, most of the time, it's not the first exposure to this hazard that causes health disease or that causes disease for the employee. Most of the time, it's due to negligence or not reporting exposure to hazardous agents. And so, what are the common diseases from your experience and from what you have read and from what you have listened to and read from the instructional video, as well as the course materials that has been uploaded for you. Okay, okay, okay. Heart problems, respiratory problems, trauma, accidents. Okay, thank you so much for that contribution. You are right. You are right. Those are the common health diseases that majority of workers have. Accidents, trauma, injuries, amputation, hypertension, all of these are the common diseases that is prevalent among workers. How do we prevent employees having disease? It is your role as a nurse that is working in an industry, not only to be ready to attend to emergency, not only to give health education, but also providing information on preventive measures to all these diseases. So I'm going to share a few slides on what I wrote. Here we have predisposing factors to occupational disease, which are lack of safety and protective equipment by the employers to the workers. In some industries, the employers do not provide for the workers safety and protective equipment. It is the right of the employers, it is the right of the employees, I mean. You as a nurse that is working in that company, you need, that you have observed, you need to tell the employees to request if they are going to enjoy good health, if they are going to prevent occupational disease, you have to encourage. Part of your role as a nurse is to encourage workers to request from their employers a protective equipment. In a situation whereby the employers provide all these, the PPEs, we also have workers not using them. And so if that is the case in the place you work, your role also is to encourage workers to comply to the rules and regulations of the industry, of the company, to use the safety materials that has been provided. Also, poor personal hygiene and working environments can predispose employees to occupational disease. Lack of periodic medical investigation of the workers. It is very important that an employees take periodic medical investigation. This helps to know, because at the beginning of their work, they have done a medical investigation, a medical examination, their health status are known. And so as they progress in the work, it is important to also do periodic medical examination to be able to know if the work is having a stress on their health. This can help you as a nurse to advise their employer to relocate them to another section that will be less risky to their health. And lastly, we have exposure to chemical agents and injection of toxic substances. So, what are the ways to discover hazard risk in the workplace? Biological monitoring is very essential. Environmental measures, as well as epidemiological monitoring. What do I mean by biological monitoring? Like I earlier mentioned, pre-employment medical examination, as well as periodic medical examination. What about the environmental? In the environmental measures, you want to eliminate every forms of hazard to the workers in the workplace. You identify hazard, you identify risk, you reduce it in a situation whereby it cannot be completely eliminated. Epidemiological methods. This is a process of studying the determinants or distributions of disease among workers in order to detect both the occupational and the non-occupational work-related disease. And so, as I stop sharing the slide, let me get your feedback on what you understand so far. Is there areas that you would like to add or ask for clarification? Okay. I crave your participation, your contribution. Strategies for prevention of occupational disease. I mentioned elimination of hazardous agents, suitable training for all workers, administrative controls, provision of personal protective equipment, maintenance system to track hazard and correction, emergency preparation. And so let's quickly have a 5-minute quiz. Since you have decided not to ask me question, I'm going to ask you question. So let's have 5-minute quiz. I'm typing the question on the chat. You respond and send your answer on the chat, and it will be added to your assessments. Mention 5 strategies to prevent occupational health disease. Okay, that's a short quiz. Send in your answer And the next, in closing. So as you're typing your answers to the quiz, in conclusion for this class, we see that every occupation has its own risk and hazard associated to it. And for that reason, the only way out is to stick to compliance, to comply to preventive measures by rules and regulations of the company, adhere to health education that is provided, report any risk or any stress that your job is giving to you, or any injury sustained, you need to report it, as well as avoidance of unsafe practices. And what do we mean by unsafe practice? The unsafe practices, when your job description says, don't do this, you have to avoid it. Do your frequent medical assessments, as well as early treatment of identify health problems. Okay. Thank you. Thank you for your participation. I can see your feedback. Okay, your answers are taken and noted. Okay. Okay. All right, thank you so much. As I'm getting your quiz answer feedback on the chat, I want to encourage us that let's encourage our colleagues that we also know. Let's remind them also to join the class. It's every Thursday, 5 to 6 p.m. And let's come prepared. What do I mean by come prepared? You come a day to your class, an instructional video would have been uploaded on your page. You download it, you listen to it. You also go through your course materials so that you can understand what will be discussed in the class. It is only as you do this that you will be able to interact, and the purpose of the Zoom class will be actualized, because it's simply to facilitate students. It's a forum where we can rub minds together. But when you are not able to listen or read through the materials that has been provided, you'll be clueless on what will be discussed. And so you won't be able to make an active participation. And so, thank you. Okay, I can see your comments. Keep sending them, and they are noted. So, are there questions so far for me? Are there things you would love me to clarify before we close today's class? For those of you that are present, I want to say thank you for joining the class, and I encourage you not to miss out in any of the classes for the next 8 weeks of this facilitation. And if there are no questions for me or areas you want me to clarify, I think we will end the meeting today. Thank you for attending the quiz. Thank you for your answer. Yes, you are right. Okay, thank you for that suggestion. I actually did send message to all the students. So, but I didn't send an email, but I think I will have email from next week going forward. I will send both message and email to all the students so that you can be reminded. Thank you for your suggestion. It's well taken. Any other suggestion on how we can improve on this facilitation, or how you think I can encourage your colleagues to participate fully? Okay, I've noted that to send email prior to the class. That is well noted. It will take effect from next week. But mind you, I do send message, but for email, I've not managed to send an email, but effective from next week, I assure you, you will start getting emails from me as a reminder, at least the day of that we are going to meet. Okay. All right. So if there is no question, if there is no further question or suggestion, we are going to end the class today. I'll see you same time next week, Thursday, 5 p.m. to 6 p.m. Please encourage your colleagues as well who you didn't see on the forum today to join. God bless. Bye.